Hi, everybody. Welcome to Coping with October. We're going to get started in just a minute. Sorry for the delay. We're having a technical issue. So I just want to give it one other minute to let some additional people join. Okay, so welcome, everyone. Welcome to Coping with October, Ideas for Those Living with Metastatic Breast Cancer with Dr. Dizon. Again, I'm sorry for the delay. We were having a technical problem. So before the presentation begins, let me tell you a little bit about SHARE. My name is Christine Benjamin, and I'm the Breast Cancer Program Director at SHARE. So SHARE is a 37-year-old nonprofit organization that helps people through breast or ovarian cancer, offering the unique support of survivors who've been there. Our services are free of charge and include helplines, 6 telephone support groups each month for women living with metastatic breast cancer, and educational programs. For more information, you can always visit our website at sharecancersupport.org or call our helpline, 844-ASK-SHARE. So today's program will start with an introduction by Catherine O'Brien, the Secretary and Public Relations Chair of the Metastatic Breast Cancer Network, followed by a presentation by Dr. Dizon. So during the presentation, you're welcome to submit questions. You can submit questions or comments through the question pane in your control panel. You can access the question pane by clicking on the red arrow in the upper right corner of the screen. Type your question into the space provided, and you can raise your hand by clicking on the hand icon, also in your control panel. We'll compile the questions and ask them at the end of the presentation. So now I'd like to introduce Catherine O'Brien. Catherine?
Thanks, Christine. About the Metastatic Breast Cancer Network. Founded in 2004, the Metastatic Breast Cancer Network is a national patient-led advocacy organization. MBCN held its first patient conference in 2006. We just concluded our 2014 conference at UNC's Lineberger Comprehensive Cancer Center. Stay tuned because videos from that event will be posted soon at our website, www.mbcn.org. Also, please like MBCN on our Facebook page for ongoing news and events. We are posting a metastatic breast cancer fact a day leading up to October 13th, which is National Metastatic Breast Cancer Awareness Day. And now I'd like to introduce today's speaker. Dr. Dizon is board certified in medical oncology and specializes in the care of women with breast and gynecologic cancers. He is an associate professor at the Warren Alpert Medical School of Brown University and sees patients in the Gillette Center for Gynecologic Cancer at the Massachusetts General Hospital Cancer Center, where he is also founder and director of the Oncology Sexual Health Clinic. He also serves as a deputy editor in oncology and palliative care at UpToDate. He's an active columnist for ASCO Connection at www.connection.asco.org, which was recognized with an Apex 2013 Grand Award for Publishing Excellence. Don, the floor is yours.
Thank you, Catherine. It's a real honor to have been asked to participate in this webinar, and I want to really thank both SHARE as well as MBCN for putting it together. The topic is obviously one of great importance, especially in October. And in order to address it, I titled it Living Beyond the Pink-Colored Glasses of October. I think there's quite a bit of sensitivity around October and the issues that we as a society focus and concentrate on. But I think the voices of those women who are actually living the experience of breast cancer, and especially those women who are living with breast cancer as a part of their regular lives, should not be lost in October. So next slide, please. So Breast Cancer Awareness Month is one that, historically has served a very important role. If you go back to our nation's history, probably to the history of the world, cancer was something to be hidden in the shadows, and certainly wasn't something that people talked about in polite society. In fact, it was quite stigmatizing, and I think it's because of work of pioneers of cancer research, as well as our advocacy organizations, including the American Cancer Society. We've been able to break through that, and now cancer is no longer a stigmatizing diagnosis for the vast majority of people. And Breast Cancer Awareness Month has been an important part of that, to bring in an awareness of breast cancer as an issue, and hopefully tie it towards fundraising so that we can do better. However, as we look at Breast Cancer Awareness Month today, it's a lot of pink, it's a lot of ribbon, it's a lot of mentioning of boobies, and I think a large focus of this has been in two areas which are listed here. It's been about prevention of breast cancer. It's been about the early detection of breast cancer, and it is not to detract the importance of either of those in how we are going to treat, diagnose, screen breast cancer in our society, because I do think those are important. Next slide. Putting that into perspective is here, and this is one of the beautiful statistics slides that you'll see all throughout October, breast cancer awareness, and it's an emphasis on early detection and how that can save lives. It gives us the statistics that 1 in 8 will develop breast cancer over her lifetime, and it gives some hope here that detecting early stage disease can be curative, and that there is a difference in survival. If you have advanced disease, about 1/3 will survive, and if you are diagnosed early, then it's almost universally curable. However, there are issues with these kinds of statistics. Next slide. The other thing that Breast Cancer Awareness Month has sort of, perhaps not knowingly, fostered is this notion of breast cancer in the war mentality. And this slide illustrates what I think is a problem when we use that kind of language in the general public. The use of cancer as a war means that everything is a fight, which means that you're always on guard if you have breast cancer. And then the question then becomes, what of those who have died of their disease? And this slide I actually do not like very much, because it says it's, the awareness campaign is gated to all those who've lost the fight and to those who won't quit the fight. Now, if you engage in this kind of mentality, there are winners and losers in a fight. And the question then becomes, is this the kind of language, communication, that cancer in general and breast cancer specifically should be discussed around? Next slide. The bottom line is that when it comes to October, as it is throughout the entire year, people don't necessarily identify with imagery. And at times in October, I see a lot of patients, some of them my own, who just don't feel very pink. We would love to believe that breast cancer will not impact a person's life, and that they will go on as they had before cancer, or will look towards life after cancer as nearly normal as they were before. Next slide. But in reality, that is not the case. And one of the things that we are often told in society is that cancer is a gift. But in actuality, it is not a gift. You ask any woman who's been diagnosed with breast cancer, they may have, identified some things they have learned about themselves from cancer. They may have even defined a strength that they never knew was possible after cancer. But cancer is not necessarily a gift. And I've taken it to the extreme as to say why, and not necessarily to this audience, but necessarily perhaps to our public audience. Cancer is not a gift because you can return a gift. In fact, you can exchange a gift. You can return it for cash or credit. This is not possible with breast cancer, but what really brought it home was Barbara Enrick, who published this story in The Guardian now 4 years ago, and in it she confronts this issue of cancer as a gift. And she states, and I think most of us on this line will probably believe, using that kind of language, sugarcoating cancer can be harmful, not only for someone's psyche, but also for the people around them in trying to understand what the illness is going through. I like this last line where she says, in the lore of this disease, chemotherapy smooths and tightens the skin and helps you lose weight. And when your hair comes back, it will be fuller, softer, easier to control, and perhaps a surprising new color. She calls it like it is. This is insane. Next slide. So why this topic? Why living beyond the pink glasses of October? It's because of what we are now understanding about breast cancer in 2014. Breast cancer is not one disease. Breast cancer comes in 4 stages as clinically defined, stages 1 through 4. Breast cancer has 3 different grades. Grades 1, which is a well-differentiated cancer, to grade 3, which is a poorly differentiated cancer. And we now know that using genomics, breast cancer has at least 4 different subtypes, from the luminal subtypes all the way up to the basaloid or triple-negative subtypes. Because of these heterogeneities, not everyone faces the same future from breast cancer. Because, and this is a quote from someone very dear to me, no one dies from breast cancer that stays in the breast. The point of fact, particularly for women living the experience of breast cancer, the language of October, screening and prevention are irrelevant after you've been diagnosed with metastatic disease. And for patients with metastatic breast cancer, the issues and even the term of survivorship does not universally apply, perhaps because folks like me have sort of taken that language of survivorship care plans and have used it specifically to women who are completing curative or adjuvant intent therapy. The question then becomes, maybe we need a new language. Next one. So I was asked to address how can one meet October, especially in the face of metastatic breast cancer. And I gave this a lot of thought and spoke to a lot of my own patients. And what I'm going to give you here is just some thoughts that I had as an oncologist who has walked this road with my own patients and continue to do so. Next slide. The first is that when it comes to October, with all its pink lingerie, pink Coke bottles, pink Kentucky Fried Chicken, don't sweat the small stuff. Rule 2, recognize, in the world of advertising, it's all small stuff. And Rule 3, when in doubt, refer to Rules 1 and 2. Next slide. Because it is October, it is a forum that all women with metastatic breast cancer must be heard. So be fearless and speak now. Be that person who goes to those fundraising events wearing a shade that is not pink and engaging with people as the face of a woman living with metastatic breast cancer, and push the message that not everyone will be saved by mammography, and that the language of screening and early detection only reaches a subgroup of women who have been living the breast cancer experience. And in fact, it's not an experience. Breast cancer is part of their lives and not the part that they can ignore. Next slide. Third is reach out. Recognize that October is a time when the entire world seemingly does reach out for women in general, but also for women who have undergone the experience of breast cancer. But it can be very isolating, particularly in the language of October, especially when you don't see your images portrayed well, accurately, or at all in the media. Recognize that your community, that our community of women and men with metastatic breast cancer may feel as isolated as you are. So reach out to your fellow person living with breast cancer and get through it together. Next slide. Remember to laugh. Everything is labeled in pink in October, whether it be that nicotine supplement that will give you more energy in the middle of the day, the Kentucky Fried Chicken canisters, even Marlboro cigarettes. Just remember to laugh. Today, I will live in the moment unless it is unpleasant, in which case I will eat a cookie. Next slide. Remember always, and especially in October, that you can be the source of change, that you can advocate, and never doubt that a small group of thoughtful women and men can change the world. Indeed, it's the only thing that ever has. And I think this is particularly true as we push for better treatments, as we push for more research funding. Your voices are critical. Next slide. Celebrate in October. Celebrate what you have been able to accomplish as a group, whether it be through organizations like SHARE, the Metastatic Breast Cancer Network, which was one of the founding members of the Metastatic Breast Cancer Alliance, through the work of MBCN and others. October 13th is recognized. Yes, you have a day in October during that month of breast cancer awareness. It is a start, it's not a finish, but the work you have done should be celebrated. And I also would include here the work done by MetaViber, which is a crowdsourcing platform for research specific to the causes that are important to you. As we celebrate, as we go through October, we also should take a moment and pause and remember. Remember folks like Jody from MBCN, remembering my friend Christina, both of whom died of their breast cancer. We should never forget them. And this is our opportunity to memorialize and laugh at all of the joy that they brought us in our lives, and not make it be that they were not defined by their breast cancer, even though breast cancer did take them away too soon. But we should remember them, we should laugh with them, and keep them always in our hearts. Next slide. This is actually probably one of the more important things I have to say, which is no matter what day, what month, or what year it is, take responsibility for your life, manufacture, be the guardian of your own happiness, no matter what that looks like. Next slide. Because it's important, particularly in the context of living with a chronic disease like metastatic breast cancer is, that you do it your own way. And this is a column that I recently wrote for the American Society of Clinical Oncology. And it told the story of two women who approached the diagnosis of metastatic disease very differently. Next slide. And in this column, I write that they did not do what I said they should do. They did not do what their families thought they should do. They both did what they thought they needed to do. One woman chose treatment and took all the toxicities, and it was her values and her goals were to live through her breast cancer and take all the toxicities that treatment meant, because her goal was to live with this disease. That was her goals and preferences. It was not mine. It was not necessarily her family. My other patient looked at all of what she had been through, took the diagnosis of metastatic breast cancer, understood it wasn't curable, and made the decision that life lived well was more important than life lived long. And she opted not to pursue therapy despite my recommendations and despite what her family had wanted her to do. She chose to do it her way. Indeed, they both did. And this is just some comments that came up through Twitter about this. And it just shows that this is something that is important to give voice to, that your way, your goals, your preferences must be balanced with what we can offer you as clinicians and what outcomes we can hopefully attain, but above all else, with your best interests at heart, informed by exactly what you're telling us. Next slide. My ninth suggestion of how to get through October is to appreciate every single day and the opportunities that you've had to interact with others, to love your family and your friends, and to see what you think and consider beautiful. Two people have expressed this to me in very different ways. Lisa Bonchek-Adams has a beautiful challenge to us, and I try to meet it as much as I can, which is to find something beautiful and share it. Whereas another patient who was on a panel I was on for the Massachusetts General Hospital Cancer Center put it differently. She chose to find something to laugh about and engage someone else into the laughter. Next slide. My last message is one of hope. As a clinician who also has been involved in research, the only way I stay in this is because I'm hoping that we will do better and that my patients will be beneficiaries of the advances in science. I think it is real. I think I am seeing some of those advances making its way into clinic. So as much as your wishes, your goals and preferences are for your own lives, I want you to maintain hope that we, and I include all of my patients in that global we, can make those realities true. Next slide. So the bottom line is, although you might feel isolated from the breast cancer awareness campaigns of October, or angry because messages are not relevant to your scenario or situation, or frustrated because you do not see your experience mirrored within all of the news stories that cover October and Breast Cancer Awareness Month, I don't think the answer is to get angry and fight against perceptions. Next slide. I think we should take that, all of the messaging, all of the stories, and all of the ridiculousness that is that is plastered in pink, and use it as a reminder that for patients, advocates, clinicians, all of us involved and immersed in the treatments and in helping live with metastatic breast cancer, we need to use October as our reminder that the work has just started and will continue. Next slide. So it is with heartfelt sentiment that I say thank you so much for letting me be a part of your day. Thank you very much.
Thank you, Dr. Dizon. So we have a bunch of questions here. So I'll start with the first question. Are survival rates on the pink slide showing 1 in 8 and high survival rates on earlier stages based on 5-year survival?
Mm-hmm.
So how helpful are those statistics given ER-positive breast cancer can spread 10 plus years after initial diagnosis?
The 1 in 8 figure is a historical one, which we have used to estimate the risks of breast cancer as an initial diagnosis. So that's not the risk of someone experiencing recurrent disease. It's a figure that is often touted during Awareness Month in October, but also when we explain the benefits of screening mammography, is that 1 in 8 women will ultimately be diagnosed with breast cancer in their lifetime, and their lifetime is a very long time. The figures that show survival rates traditionally will be shown at 5 years. What we do not know, and it's actually one of the things I'm most interested in correcting with hopefully support from NBC, and which I know they're also interested in, is those survival statistics are often misleading. 98% survival doesn't automatically mean cured. You are all surviving breast cancer and are included in the statistics of survival. Survival, statistically can mean surviving with cancer. It could also mean surviving with cancer and alive at the date of survey. It can mean survival from breast cancer, i.e. those who have not died of breast cancer. And I think that's one of the issues when we cite survival statistics like that, 98% survival at 5 years. The automatic assumption in the public side is, oh, cure. But we do know very well some groups, particularly women with hormone receptor positive breast cancer, will be fine at 5 years, but face a continuous, very small but very real risk of relapse beyond 5 years, whereas the alternate is true for women with triple-negative breast cancer. Their biggest risk of relapse is going to be within the first 3 years of diagnosis, but that does not mean at 5 years it will never come back. The message that October should bring, there are no guarantees after a diagnosis of cancer.
Okay, great. So there are a bunch of questions, sort of individual treatment questions.
Yeah.
And I'll save some of those toward the end. If we have some time, I'll throw a couple out at you. But here's another question. Isn't it true that 30% of early-stage diagnoses ends up metastatic? Isn't it a false promise to say early detection saves lives? Isn't it untrue to say almost universally cured if detected early?
Well, I think the person who raised this question gets to the heart of an issue that I think has been sort of miscommunicated almost from the start of awareness campaigns. Early detection is not prevention, number one. The only way we can really prevent breast cancer is by bilateral mastectomy, and the last time I checked, that was not a national policy anybody was supporting. Mammography can help with early detection, and most women who have breast cancer detected early will live through it. But those cancers detected early span the gamut from DCIS, which right now in breast cancer academia, we're questioning whether or not it should even be called a carcinoma because the prognosis is so good, rather than the patients with a triple-negative breast cancer who may not be detected by mammography. So it is a very mixed bag. And in terms of early detection and early stage breast cancer being curable, more curable, depends on what that comparator is. If you're comparing it to women diagnosed, de novo diagnosed with stage 4 breast cancer, yes, that's very true. Women diagnosed stage 1 are going to be, there's going to be a higher likelihood of cure with stage 1 versus stage 4 disease. But within stage 1 disease, what we know, and I think you all know, is there's so much heterogeneity in what that figure states, and that we cannot simplify any longer by stage what prognosis will be. So I think the questioner is spot on. The messages are often mixed or often unclear and don't reflect the evolving biology and understanding of breast cancer today.
So along the same lines with early detection and prevention, isn't it true that there's no real prevention of breast cancer other than, what you mentioned,
right,
is bilateral mastectomy? So would it be, is it really about risk reduction?
It is all about risk reduction, correct. And it's all, even risk reduction and early detection are really two very different objectives. Risk reduction does not mean you don't need mammography, for example. Mammography being a screening test that will hopefully meet the objective of early detection. Mammography does not reduce risk of breast cancer. So again, there is this big confusion, and I think it's quite possibly one thing that we don't think about in the general public any longer is the goals that are being touted in Breast Cancer Awareness Month are actually multiple and different objectives.
So can you talk a little bit about ways that people living with metastatic breast cancer can inform non-cancer patients about what Pinktober really is, and also about how much of the money raised by the pink products really goes to breast cancer research?
And I would love Catherine's take on this as well, but there was just a very important tweet that I actually retweeted earlier this week, meaning Saturday, about exactly that. Before you donate to your pink products, get informed about what, how much of what you're spending will go to breast cancer awareness, and B, what exactly that funding is going to go towards. It's a big black box, but there is this drive towards more transparency, at least as it comes to the advocacy organizations. Now, when it comes to specific products, it's hard to know where they're going to donate unless there's a partnership. That's fairly obvious. If there isn't a named partnership, like, so-and-so proceeds will go to the Susan G. Komen Foundation, you know where they're going. But if they're saying, 5% of every dollar earned will go towards breast cancer awareness, what does that mean? I think it's a really relevant question to ask. And in terms of promoting awareness of what breast cancer means and what it means to have metastatic disease, I think this is where it becomes very very sensitive in terms of marketing, because really that's what October is now. It's a marketing strategy aimed at raising funds for breast cancer awareness and breast cancer research, and I mean research in the most global sense of the word. Part of the way you can do this is exactly the tact that hopefully this webinar will reach. It's to be a part of the conversations during October and not feel like your voice is not relevant, because it's very relevant. You see all of these projects about Save the Boobies, and you might be that woman who has already undergone a bilateral mastectomy, but it doesn't mean that your issues are any less important or that your story is any less relevant to October. You are a part of October. Part of what I think I would love to see happen is that you become a part of those conversations. You show up to those pink events wearing a different shirt, different colored shirt, and just raising the voice and engaging in women who may not understand that the issues of a person living with a metastatic disease is not equivalent to the patient who is scared of getting breast cancer or who has gotten breast cancer and is now being treated with curative intent. You have commonalities, but there are very important differences. But bringing about those differences will also lend the story to how important that we get right the story of breast cancer during October. Catherine, I don't know if you had anything else to add.
I would just second what you said, Dr. Dizon, in terms of being involved locally. I think that's where you can have great impact. If you see a retailer or a hair salon and you suspect that perhaps they don't really understand the true picture, you can have that conversation and you can make a difference. I think there is another group, if you were looking for specific commentary, I think it's the breast cancer, is it National Breast Cancer Alliance? It's anyhow, if you Google Think Before You Pink, they have some specific comments on that. But I agree with what you said, Dr. Don.
Okay. Good.
So in response to point number 4, asking us to laugh it off, someone's saying, sometimes we may need to lighten up, but this is very serious. It's not about boobies. It's not about saving tatas. It's about saving lives. That message gets lost, and I can't laugh that off.
I think you're absolutely correct. And in terms of the messaging, you have a choice, I think. Either you can let all of the messages, because there's so much in October, all of the commercials really get to you, or you can really focus in on those campaigns which you think, boy, this one really got it wrong, and I want to do something about it. So that slide that said to, just remember to laugh, sort of ties into the first slide, which is, what, all the commercials and all the product placements and all of the pink berets out there, it's all small stuff, really. And if you doubt that, then just put it in the perspective of your own issues, your goals, your preferences, your treatments, and your priorities, which might be local and might be national, but use them as a means to do something about it, because again, it's all tied to advocacy over a cause that is essential to the women living with metastatic disease. So I didn't mean to imply that you just have to lighten up. That is not that is by no means what I mentioned. But you've got to admit, some of these product placements are incredibly ridiculous. And if you find yourself laughing at about how ridiculous it is, give yourself that. You're owed it. It's fine.
Thank you. So someone else wrote in, I'm having trouble communicating with my friends who are breast cancer survivors but are in remission. They don't seem to get it either. It would be helpful to learn some communication strategies with others who are survivors but aren't metastatic.
Right. I think that sometimes, if looking back on the initial diagnosis for a lot of women, all they remember is how scary it was. And I'm seeing a lot of women in my other hat that I wear in the sexual health / survivorship realm, where the diagnosis of breast cancer was incredibly traumatic. And it's not to say anything about the trauma of being told you have metastatic disease, because I having to be on the side of informing women of that diagnosis, I know and I've seen firsthand what that might be like. But for a woman who's walked that path and is currently in remission, sometimes being told that, oh, well, I'm living with metastatic disease can bring back that whole experience again, and all the fear and all the anxiety about, oh my God, this could happen to me and I could die of breast cancer. It always lurks underneath the surface, particularly in women who have completed therapy within a year. This sort of sense of trying to find the new normal is balanced by this sense of fear, of anxiety. I think for the woman living with metastatic breast cancer, they need to understand, and maybe one way to approach this is that, this is the path that I need to walk. And, it's not the path that you will necessarily ever experience, and God, I hope you don't. But it shouldn't detract by the things that you have a sense of. They may be in the world of pink and recognition, and I hope this doesn't happen to my daughter. I would suggest that we should not detract by their passion, which is to prevent the same things happening to them. So my sense would be to try to find some common ground as to, this is important to you, it's the message of prevention. And I totally get it. But my message is also, we need better treatments, or I need to have access to services so that I can live through and live this as long as I can. And I think if you make it your own experience as opposed to a global experience of, you need to understand what this is like. What I've always found helpful is framing it in the first person. I feel like my questions have not been answered yet, or I don't feel a part of this movement in October, or I feel, as someone living with metastatic disease, that the issues aren't aware of it. You'll find, I think, most people will be able to engage when you frame it as my own experience. But what sometimes people will be unable to sort of engage with, or maybe uncomfortable, or just unwilling to engage with, is when we all say, we should all care about mammography, or we should all care, or we should all understand what breast cancer is like. The person living with lung cancer won't want to hear and won't see themselves as that part of we. So make it about me, and I think that might be the best way to start.
Great. So someone is asking, how do we find a place within the wider breast cancer community when our status is frightening to those not living with metastatic breast cancer?
I think part of that, and Catherine, I'd love to hear comments on this too. Everyone hears the term metastatic breast cancer, and they all remember someone they either saw in a movie or knew in person who ended up dying of the disease. And that's the image we all carry. It might be very subconscious, but it's there, and it scares us. And I think that's the dilemma within the public in general, and messaging about metastatic breast cancer. But I've had women in my practice who lived with breast cancer and never looked like one of those mental images that one could conjure up. So I think part of the way you find your place, quote unquote, in the breast cancer awareness world is to present you as yourself. Not everybody is going to look like 5'10", blonde and blue-eyed, touting breast cancer awareness. We all have our lumps, and I think we need to be a part of that community. There has not been, I don't think, an obvious or apparent shunning of women with metastatic breast cancer. Perhaps in the messages of early detection and prevention, there's been an overwhelming preponderance of attention towards those areas. But I think we're seeing that change, and I'm hoping we see the identity of the needs of metastatic breast cancer as experienced by both men and women increase during October. Catherine?
Yes, I have to just disagree slightly with the shunning part because unfortunately that does happen. It's not as one might imagine, someone being chased out of the village or something like that, but it does unfortunately still happen where if someone goes to a support group and it's for all breast cancer, and this has happened, they'll say, oh, maybe you shouldn't mention this, or you might not be comfortable here, and that's difficult. And that sort of has to be addressed on a case-by-case basis. That is one reason on October 13th We're going to hear more about the Metastatic Breast Cancer Alliance. I think we're going to, see some strides there. My specific advice would be there is support. You can find a community of other people living with metastatic disease. Christine at the top of this presentation mentioned the helplines that SHARE does. At the mbcn.org website, we have a listing of in-person support groups on state by state and some Canadian offerings. We also, there's a number of online support groups. In recent, I would say this last year, there have been a couple very popular Facebook groups which are closed, meaning essentially that you're not seeing these postings publicly. And I really think those can be. I think that's a great place. You can go to ask questions among those who kind of get it, and it's also a place if you need to blow off steam when people don't get it. That's a great place too. But what I would say is you can find support. You can find other people who kind of get what you're going through. You can look to SHARE and MDCN to help you identify some of those things. And I guess, finally I would say keep your head up.
Yeah.
And, I just wanted to add that, as Dr. Dizon mentioned earlier on, and you saw the logo on one of the slides, the Metastatic Breast Cancer Alliance is sort of a newly formed alliance of all the major players in the breast cancer field. And the focus is on, obviously, metastatic breast cancer. And this group together, is doing a bunch of things to be able to change awareness into knowledge and to let people know what living with metastatic disease is really all about. Also, there's a big research component where a group of people looked at all of the research that's being done in metastatic breast cancer, and are going to make recommendations as to where research, should specifically look at. So, so there is a lot happening, and there are always things that you can do. So, by looking at the websites that Catherine mentioned, and also the Metastatic Breast Cancer Alliance website as well, you'll be able to see some of that information. So there are lots of questions about people's individual treatment. We're not going to have time for a lot, but I thought this one, Dr. D, I thought you would be the perfect one to answer this. So I was just diagnosed August 1st with metastatic breast cancer to the bones. It seems that it's already progressing, and I want to know what the average life expectancy is.
Well, so again, those kinds of issues are only a little bit difficult without really getting into the details of what is actually going on. What I think the best way I can explain it is that the survival for women with breast cancer is as diverse as women themselves. And we do know that there's certain patterns that are less aggressive than others. One of those is metastatic disease to the bones. We do know that women with disease that's limited to their bones tend to live on the order of years, and they're not looking at survival in the period between days and months. It tends to be a very chronic process. If there is visceral involvement, i.e. involvement of the liver and lungs, we tend to become more worried about that, quite frankly. And treatments tend to be effective, but it also will depend on what kind of breast cancer subtype it is. So if the progression is solely in the bones, then I'm still not worried about that.
Thank you. So, so Catherine's partner in crime wrote in and said, I would like to say that it's okay for you to just withdraw and avoid Pinktober as best you can. Turn off the TV, turn off the talk show, stay off the internet, whatever helps you get through this. You're the most important person.
I think that's fine. I think that's very good advice. I mean, basically, I don't think you need to look at October as a mantle to carry or actually to fight against. Taking care of yourself is probably the most important thing. And if it's easier psychologically and physically to avoid it altogether, then you know what? That should be just fine, and no one should tell you otherwise. If you want to be more proactively engaged within or despite the pinkness of October and all of its messaging, then I think all power to you, and I think you will find that there is national support for however you want to do this.
Great. So just to address some of the questions that are coming in, a transcript will be available of this webinar, not exactly a transcript, a recording. And so if you're listening now or if you've registered, you'll be notified when a recording is available. So a bunch of questions here about treatment. Is a mammogram necessary for stage 4 if you have a yearly PET scan?
So that's actually one of the questions that I'd love to get answered. I'm trying to do some crowdsourcing research into standards of preventative care for women who are living with metastatic disease. And, you know, it's surprising to know that these are actually really common issues that we try to work through with our patients on almost a weekly basis in terms of, I have metastatic breast cancer, how important is it that I have a colonoscopy to screen for colon cancer? Or, you know, do I need to have my blood levels checked for cholesterol if I'm living with metastatic breast cancer? You know, we don't have a lot of data to show what are the benefits of doing, you know, a lot of these procedures. What we do now is sort of, it's a combination of looking at your individual prognosis, looking at whether or not those kinds of tests like mammography is important to you in terms of staying healthy, and whether or not we would want to do anything if we found something. If the question is, does a PET scan work as well as a mammogram, the PET scans are good, but they won't give the kinds of detail that you're going to see with mammography, i.e., you know, PET scans will light up or not light up, but, you know, whether or not that really is specific towards cancer is not clear. So I would hazard a guess that if your PET scan lit up in your breast, you would still have to get a mammogram. But the mammogram would be a diagnostic mammogram where they're going to try to really concentrate on the area of interest. In general, I would only do PET scans if there was how I followed a person in the very beginning, because, say, a CAT scan wasn't very sensitive or didn't pick up disease that I knew was there on PET, then I would follow by PET scan. But in general, I don't look at a PET scan as a way to survey the breasts well. If I wanted to do a test to look at someone's breasts, I would still be starting with a mammogram.
And this will probably be the last question, but Dr. Dizon, in your opinion, what's the best way to explain to someone that you will not beat this like you did the last time?
Mm-hmm. You know, I would say, and it's going to be very specific to the diagnosis and the clinical situation. Those are very hard conversations because I think, you know, in one of my other lectures, what I think everyone here probably should know, if you don't know it already or understand, is that seeing someone go through cancer and go through the trauma of a diagnosis of metastatic disease is so difficult. that we are sometimes in the position of cheerleader. You feel good, but because we need to do something. So understanding the perspective of the person you don't think is understanding where you are, or that you're not sure you're seeing eye to eye with, is really important, because that might be their coping mechanism with your illness, that they are not ready to face how hard or how devastating this might be. So, you know, understanding that is more important than barreling through and shaking them and letting them know, I might die of this, or I have metastatic disease, I will never be cured of this. But there are things that can happen over time. You know, mentioning to them that, you know, breast cancer, the way I have it, hopefully will be like me having diabetes. Because, you know, diabetes is not a scary thing. Everyone's heard about diabetes. Everyone doesn't equate with death. And I think that's one of the things that we can start to have our loved ones sort of understand, or even our friends. My doctor said this breast cancer is no longer gone or not gone. It is diabetes care. It means long-term treatment. It means I will never get rid of it, but hopefully I can live through it and look as good as I do today. You know, for folks who are a bit more critical, or whose disease has progressed on maybe several lines of therapy, and you feel that your friends don't get it, and you're hearing things like, oh, one of these days you're going to beat this, or one of these days you're going to find a cure for breast cancer. You know, again, understanding their perspective is part of the ways to get through to them. You know, even if it is, I know you want to be optimistic for me, but I need you to understand what this experience is like for me. And again, you know, putting it into the perspective of what you are feeling, what you know, what you need them to hear is going to be more important, or probably more effective than saying to them, you don't understand what this is like, or you have no idea what kind of treatment this, you know, what treatment is doing to me. Because it puts on this sort of almost an argumentative, almost a confrontational aspect to understanding. And I think no one can ever take away, A, how you feel, and B, what your perception was of a situation. Okay, so those are yours, and no one can take that away from you. So even in the heat of a conversation where you're trying to explain your experience to them, using the words, I feel like this, or my disease has been like this for me, or my disease is doing this right now, it's going to be important. But yeah, using terms where you're not dealing with life and death when you say metastatic breast cancer, and actually, you know, putting it into their heads that there is actually another way. You can actually live with breast cancer, you know, sort of like, you know, choose a chronic disease of choice. It might be sort of like a heart condition, or sort of like diabetes. This is my hope. This is what I'm hoping for right now.
If I could just add one thing quickly based on my own experience, and that would be for those who are newly diagnosed. I would say maybe you know, before you tell people outside of your immediate circle exactly what is going on with you, I would perhaps not rush to do so. And the reason I say this is I have been living with metastatic disease for 5 years, and when colleagues at work asked me what I had, I was very honest, and I see these same colleagues, these 5 years later, oftentimes at trade shows and conferences, and it can be very awkward because I'm not thinking about metastatic cancer, and I'm getting the sad eyes and the, oh, how are you? And that may be appropriate, certainly, you know, I certainly appreciate their concern, but, you know, I think had I to do it over again, I might not have been, I might not have been quite so forthcoming. I would just say something like, I remain in treatment, my doctor is pleased with where I am, and so am I, or what have you. But the other thing, too, is I think that we don't always have oftentimes when someone wants to get the real lowdown on your disease, it is not a convenient time. I think of a friend who was at her son's basketball game and had to, was in the process of going to the other son's basketball game. And is that a great place to, well, let me tell you about metastatic breast cancer. It's like, oh, I got to get out of here, So I would say pick your moment, be true to yourself, but once the genie is out of the bottle, you can't untell someone. So I would, give yourself time to get your head wrapped around the diagnosis, and you don't necessarily, see how you are doing, because, like I said, I never thought of the long-term implications of sharing fully my diagnosis, and frankly, at times it can be quite uncomfortable. So I would say think about it and do what, we all deal with this differently, do what is best for you, but you'll find your own way.
Great. Thank you very much. Dr. Dizon, it's always a pleasure to have you. Hopefully we'll be working with you again in June, maybe for ASCO. And Catherine, thank you so much, and thank you to the Metastatic Breast Cancer Network for all the work that you do.
And thank you, Dr. Don, and thank you, Christine, especially to Cher for hosting this webinar.
It's always a pleasure working with both of you guys.
Thank you. And thank you all for your participation. If you have a moment to complete our short survey, it lets us know how we're doing. And don't forget to visit us at our website, sharecancersupport.org. Thank you very much. Have a great rest of the day. Bye.
Bye-bye.